Have you ever treated a client's pain, seen them get completely better, only to have it come back a few weeks or even a few months later? It's frustrating for both you and your client, right? There are often multiple injuries in the knee. There are 23 possible injuries in the knee that are very common. I treated a dancer once a while ago, and there was pain all over her knee. She had multiple injuries. Both of her collateral ligaments, those are the ligaments on the medial side and the lateral side of the knee, plus the coronary ligaments that mediate rotation of the lower leg. Those coronary ligaments attach the cartilage to the tibia and allow it to move forward and back. And I treated all those things, and she got better, and she would stay fine for a couple of months. I remember once she told me she went out dancing one night, just social dancing, and she just came back. They were all injured again, and then we treated her again, and she got better again, and the same thing happened. And she was a professional dancer, so she was always moving. But if she did something unusual, it would come back. And so there was something that was underlying her pain that I couldn't really help. And so I really retested her and looked at her, and she was very lax in her ligaments. You have these cruciate ligaments that are crossed in the middle of your knee, and you have the ones on the outside, and they were kind of loose. So things were rocking around. So, for example, if I snuck into your house and I unscrewed the hinges on your door a little bit, and then you kept using that door, it would break off the hinges eventually. And that's what happens when you have loose ligaments that are too long for the job they're supposed to do. And so she kept hurting herself because she had these loose ligaments and kept re-injuring herself. So what I did was I said, hey, you need to really have these ligaments tightened up. And I sent her to somebody very skilled at something called proliferant therapy, which tightens up the ligaments, her cruciates, her collaterals, and she never had pain again. She became the director of a school of dance in Colorado and never had a pain again after years of off and on having knee pain. The reason that assessment is so important is that it tells you who you can help and who you can't. And in this particular case, I could help her somewhat, but not all the way. So if you have those skills, before you even start, you know if you can be effective or not. When you help people find the right help and they get well, even if it's not you, they are so thankful and refer you people forever. I have clients who I've seen a few times. I just referred them to somebody who helped them, and they keep referring me clients for years and years after that.